toolkit for healthcare professionals have been either distributed or downloaded almost 11,000 times. So that's been a very active and I think very successful campaign.
Thank you. Any questions? I'm going to go this way this time. Leonard.
Yeah, Mike, I just want to, again, thank you for constantly giving us both financial information over the years as well as this latest update, which is extremely helpful. And we appreciate that. And there's a different relationship that we have with you than we've had in the past with the CDC, so that's really encouraging. On the other hand, over the last couple of weeks, there have been some very important developments with the XMRV story. We'll hear more about that in the next couple of minutes. But in one of the prominent newspapers over the last week and a half, the chief person at the CDC was quoted as saying, more or less, if I could paraphrase it, that retroviruses are ubiquitous, which in humans I don't think is the case. We'll probably hear more about that a little bit later. And that also that the CDC's efforts, particularly the person that was quoted, Bill Reeves, was that they were going to be doing work on this, but that in a sense the comment was we're not going to find it. And I'm just kind of wondering how you feel about kind of the person who's kind of the chief person in charge of the CFS program making a comment like that before he's actually completed his research.
Well, I can't comment on what another person has commented on. I can tell you that Dr. Reeves is not actually doing the laboratory work to validate the XMRV studies. That's being done in the retrovirus laboratory. And we're all anticipating the results of that. And we also hope that other agencies and other research groups will also try to continue that research in XMRV to validate that. So in terms of responding to his response, I don't have a response. I can't do that.
Chris?
I was just going to make a simple comment. It was just on the quotation from Dr. Reeves that if we validate it, great. My expectation is that we will not, which I find a little disturbing that somebody's going into an area with a closed mind, essentially. And I'm pleased to hear that it'll be other people that are going to be.
You know, those of us who've been in the research arena for a long time in many different areas know that in science, you really haven't seen anything until you have seen it twice. That's kind of what we have to say in the laboratories to confirm and make sure that exciting findings like this will stand the test of time. And that's what we're looking for. And so we're hoping that a lot of people, and I think a lot of people have shown a huge interest in this, and as has CDC.
And given the sensitivity of the situation, that those sorts of comments are not particularly helpful for any of us that are trying to move forward.
I understand.
Okay. Nancy?
I'm concerned that you're designing the study around the Georgia study, which defines chronic fatigue syndrome as unwellness and had a 5 times higher than previously thought group, clearly not a homogeneous group. And when they come up with a finding that says it's 5-fold less, oh, it's nothing. It will do so much damage to this field. And I will also underscore that we all stopped retroviral work in 1993 because the CDC slammed the door closed tight, said that has been looked at, it's clearly not there. And the funding dried up and there was no way to go after this. So if I would ask you please, as the boss, to be careful how this is done. It could do tremendous damage if it's done badly, tremendous damage. To get cohorts that are very cleanly described, very, very clear, and not just the population-based broad cohorts that you have in your freezer, which is what you have in your freezer and all that you have in your freezer. Rather, you let some of us that also have very well-defined cohorts in our freezers that were defined in a research settings. for comparison.
Okay, thank you for those comments, and we understand that. That's why there were a number, the Georgia and the Wichita, but more importantly, split samples from the Institute are actually being run. And we are hoping that for those who are interested, as you certainly have patient samples available, that if you are interested, I think you should contact the retrovirus laboratory and offer those samples.
Yeah.
And be a part of this. I think you will find an interest there.
All right. Last question.
But again, that's the retrovirus laboratory is doing this work. It is not being done in our CFS laboratories. Okay.
The five-year plan that you gave was a comprehensive plan, which is a positive thing, but the downside of that is very broad and would require enormous resources to support that. Do you have the resources to do all that? Was there any thought about what aspects of the plan maybe you couldn't address well?
We all have to consider resources every year. We have not been given our budget. CDC has not been given its 2010 budget allowance at this point. So we have to assume that our budgeted resources will likely be level, the same as it was last year. And it was the same the year before and the year before and the year before. So it's been very level funding. I cannot comment at all on what the upcoming allocation is going to be. In a strategic plan, you look at a very broad, big picture, as you know, without getting into the minute details. And we do anticipate being able to complete the components of that strategic plan, to address every part of that plan with the resources that we anticipate. No one can tell us at this point how much money we're going to get over the next 5 years. But we do, we wrote the plan in hopes that we will be able to accomplish that given the resources that we have.
Okay.
Now, obviously, we're not going to be able to say by this date we're going to do this and this and this, because so many things pop up that is just totally unanticipated.
Yeah.
H1N1 is a perfect example, but
It's the H1N1 I'm curious about, because there's already been a case report. Ross Vallings put one out just last week and was published, of chronic fatigue syndrome post H1N1. We have a tremendous opportunity to capture a new incident group.
yes.
At a defined time right now. But it's a very narrow window. This is the moment. And I'm wondering if the CDC has considered that. Personally, the concept of going back to CBT or childhood stress studies and spending the money there when you could take the money and put it into something that could really...
Almost a prospective,
this is
essentially
the
a
moment.
prospective
This
study.
is the moment.
Yeah.
we're
I can tell you the program is aware of that. I don't know what their plans are, but I can have answers to the committee if necessary.
We want to hear Dr. Peterson's presentation. This is a very important topic, and we will have time to reopen the discussion, and I'll ask Mike what his time frame is in staying a little bit longer. Well, we're very fortunate to add to the agenda fairly late, and appreciate Dr. Peterson's ability to address the important finding from the Whitmore Patterson Institute. Peterson, my dyslexia comes again. And I hope that slide presentation is all loaded up and ready to go.
Yes.
And
it's loaded, Dr. Peterson. If you could come up to the table here, there is a remote on the table. One of our staff should be cueing your slide presentation. And great. And I'm hopeful we will be ready to go. So can somebody give me a sign? Those of us up here, we don't have to get whiplash. It's right there.
That's right.
Okay. So, and there